Most people associate high blood pressure with noticeable discomfort, things like headaches, dizziness, or a sense that something just isn't right in the body. That belief creates a dangerous illusion of safety. If nothing feels wrong, then nothing must be wrong. But the reality is far more unsettling. Many individuals go about their daily lives feeling completely normal, only to experience a sudden and severe event like a stroke or heart attack without any prior warning. They walk their dogs, prepare meals, talk with loved ones, and laugh with their grandchildren, unaware that silent damage is building beneath the surface. Blood pressure does not always send signals before it becomes dangerous, and this is especially true as people get older. After the age of 60, the body becomes less responsive to early warning signs, and conditions can develop quietly over time. This is what makes high blood pressure particularly deceptive. It does not demand attention in obvious ways. Instead, it progresses in the background, often unnoticed until it reaches a critical point. The absence of symptoms is not a sign of safety. It is often the very reason the condition goes undetected for so long. Understanding this shift in how the body communicates is the first step toward recognizing why relying on how you feel is not enough when it comes to protecting your cardiovascular health. The standard method of measuring blood pressure contributes significantly to this hidden risk. In most cases, readings are taken during a brief visit to a clinic, lasting less than a minute. That measurement is then used to guide important medical decisions. But when you think about it, that brief snapshot represents only a tiny fraction of your entire day. There are 86,400 seconds in a day, and your blood pressure is being assessed for just a few of them. The rest of the time, especially during sleep, remains largely unexamined. This approach overlooks critical fluctuations that occur naturally throughout a 24-hour cycle. Blood pressure is not static. It rises and falls in response to activity, stress, and internal biological rhythms. By relying solely on a single reading taken in a controlled environment, we miss the broader picture of how the cardiovascular system is functioning. This is particularly important because many of the most significant changes happen outside of that clinical setting. The body behaves differently at home, at work, and especially during rest. Without capturing those variations, it becomes difficult to fully understand an individual's true risk level. This gap between what is measured and what actually happens throughout the day is one of the key reasons why high blood pressure can remain undetected or underestimated for years. During healthy sleep, the body follows a natural and essential pattern. Blood pressure typically decreases by about 10 to 20%, allowing the cardiovascular system to recover from the demands of the day. This process, often referred to as the dipping pattern, plays a vital role in maintaining long-term health. As the body rests, the heart does not need to work as hard, and the blood vessels experience less strain. This reduction in pressure supports repair processes in the heart, helps maintain the flexibility of blood vessels, and allows the kidneys to function more efficiently in filtering waste. It is a carefully coordinated system that depends on proper signaling from the nervous system. However, as people age, this pattern can begin to change. The mechanisms that control these nightly adjustments may lose precision, and the expected drop in pressure may become less pronounced or disappear altogether. When this happens, the body misses out on an important recovery period. Instead of getting a break, the cardiovascular system continues to operate under higher pressure even during sleep. Over time, this can contribute to increased wear and tear on vital organs. The absence of this nightly dip is not something most people are aware of, yet it has significant implications for overall health and longevity. As the body grows older, several structural and functional changes take place that affect how blood pressure is regulated. Blood vessels gradually lose their elasticity, becoming stiffer and less able to expand and contract with each heartbeat. This stiffness increases resistance within the circulatory system, making it harder for blood to flow smoothly. At the same time, the autonomic nervous system, which controls involuntary processes like heart rate and blood pressure, may become less responsive. The signals that once ensured a consistent drop in pressure during sleep can weaken or become irregular. These changes do not happen overnight but develop gradually. Over many years, the result is a shift in how the body manages blood pressure, particularly during rest. For many older adults, the expected nighttime decrease either becomes very small or stops entirely. In some cases, blood pressure may even rise during sleep. These changes often go unnoticed because they do not produce immediate or obvious symptoms. A person may simply feel more tired upon waking or experience mild cognitive fog, attributing it to poor sleep or normal aging. However, the underlying cause may be ongoing cardiovascular strain throughout the night. Recognizing that these age-related changes can alter blood pressure patterns is essential for understanding why traditional measurement methods may not provide a complete picture. Imagine a situation where an individual visits a doctor and receives a perfectly normal blood pressure reading during the day. Based on that result, everything appears to be under control. However, when that same person undergoes continuous monitoring over a full day and night, a very different pattern emerges as they go to sleep. Their blood pressure begins to rise instead of fall. By the middle of the night, it reaches levels that would be considered dangerously high if measured during the day, yet the person remains completely unaware of what is happening. They sleep through it without any discomfort or warning signs. This scenario is more common than many people realize. It highlights the limitation of relying solely on daytime readings to assess cardiovascular health. The body does not operate the same way during sleep as it does during waking hours. Without capturing those nighttime changes, a significant part of the risk remains hidden. This is why continuous monitoring can be so valuable. It reveals patterns that would otherwise go undetected and provides a more accurate understanding of how the body is functioning over time. By looking beyond a single measurement and considering the full 24-hour cycle, it becomes possible to identify risks earlier and take steps to address them before they lead to serious complications. One of the most important reasons this hidden nighttime blood pressure pattern develops is related to how medications are typically used. Many individuals are instructed to take their blood pressure medication in the morning, and while that may seem logical, it doesn't always provide protection when it is needed most. Medications have a peak effect and then gradually wear off over time. By the time midnight arrives, the protective effect may be significantly reduced or even gone entirely. This creates what can be described as a coverage gap, a period during the night when blood pressure is no longer being effectively controlled. During this window, the body is left vulnerable to spikes that occur silently. This issue becomes more pronounced with age, as the body's ability to regulate itself weakens. In addition to medication timing, hormonal patterns also begin to shift. Hormones like cortisol and adrenaline are supposed to decrease at night, allowing the body to enter a restful state. However, in many older adults, this rhythm becomes disrupted. Instead of dropping, these hormones may remain elevated or even increase, leading to higher blood pressure during sleep. Sleep quality also plays a major role. Even brief awakenings, which a person may not remember the next morning, can trigger a stress response in the body. Each of these small disturbances causes a temporary rise in blood pressure, and when they occur repeatedly throughout the night, the cumulative effect can be significant. Over time, these repeated surges contribute to long-term damage, all without producing noticeable symptoms that would prompt someone to seek medical attention. When these nighttime patterns persist, the body begins to experience a form of silent wear and tear that is difficult to detect without specific testing. The inner lining of blood vessels becomes gradually damaged as it is exposed to sustained pressure during hours when it should be recovering. This damage does not happen suddenly. It builds slowly over months and years. The kidneys, which rely on stable pressure to filter waste effectively, also begin to show signs of strain. Tiny blood vessels within the kidneys can become compromised, reducing their efficiency over time. Similarly, delicate structures in the eyes may be affected, leading to subtle changes that often go unnoticed until they become more advanced. What makes this process particularly concerning is that it rarely causes pain or immediate discomfort. The body has an incredible ability to adapt and compensate, masking the problem while the damage continues beneath the surface. People may feel slightly more fatigued or notice minor changes in their energy levels, but these signs are often attributed to normal aging rather than an underlying cardiovascular issue. By the time more serious symptoms appear, significant damage may have already occurred. This is why understanding and identifying these hidden patterns early is so important. It allows for intervention at a stage when the process can still be slowed or even reversed, rather than waiting until it leads to a major health event. The term used to describe individuals whose blood pressure does not drop during sleep is non-dippers, and this group represents a surprisingly large portion of the older population. Studies have shown that more than half of adults over the age of 65 fall into this category. That means this is not a rare or unusual condition. It is actually quite common. Despite this, many people have never heard the term and are unaware that it could apply to them. What makes this classification important is its strong connection to long-term health outcomes. Non-dippers are at a significantly higher risk of developing serious cardiovascular problems compared to those whose blood pressure follows the normal nighttime pattern. Even if two individuals have identical readings during the day, the one whose pressure remains elevated at night carries a much greater risk. This difference highlights the limitations of relying solely on daytime measurements when assessing overall health. The concept of dipping and non-dipping provides a more complete understanding of how the body is functioning over a full 24-hour cycle. It emphasizes that what happens during sleep is just as important, if not more so, than what happens during waking hours. Recognizing this distinction is essential for both patients and healthcare providers, as it can influence how conditions are monitored and treated. An even more concerning variation of this pattern is known as reverse dipping. In this situation, blood pressure does not just fail to decrease during sleep, it actually increases. This means that the highest levels of pressure occur at a time when the body should be in its most relaxed state. Individuals with this pattern often feel completely normal during the day and may have readings that appear acceptable during routine checkups. However, their risk of serious events, particularly strokes, is significantly higher. The challenge is that this condition remains largely invisible without continuous monitoring. Standard medical visits are not designed to detect it, and as a result, many people live with this risk without ever knowing it exists. The body continues to endure elevated pressure night after night, leading to progressive damage. What makes reverse dipping particularly dangerous is the lack of warning signs. There are no clear symptoms that distinguish it from other patterns, and individuals may not experience any noticeable changes in how they feel. This disconnect between how the body feels and what is actually happening internally is what makes the condition so difficult to identify. It reinforces the need for more comprehensive approaches to monitoring blood pressure, especially in older adults who may be more susceptible to these hidden patterns. In addition to internal physiological changes, certain everyday habits and substances can quietly influence nighttime blood pressure in ways that many people do not realize. Some herbal products, often perceived as harmless or even beneficial, can have unexpected effects on the body's hormonal balance. For example, ingredients found in certain teas may interfere with enzymes that regulate stress hormones, leading to increased levels of cortisol during the night. This hormonal shift can contribute to elevated blood pressure without producing any immediate or obvious symptoms. Alcohol is another factor that can significantly impact nighttime patterns. While it may initially create a sense of relaxation and even lower blood pressure for a short period, its effects do not remain stable. Several hours after consumption, the body may respond with a rebound effect, causing blood pressure to rise during the later stages of sleep. This can result in some of the highest readings occurring in the middle of the night, precisely when the body should be at rest. Dietary interactions can also play a role, particularly when certain foods affect how medications are metabolized. These interactions can alter the expected effects of treatment, leading to fluctuations that are difficult to predict. What makes these factors particularly important is that they are often part of daily routines. People may not think twice about an evening drink or a cup of herbal tea, yet these seemingly small choices can have a measurable impact on cardiovascular health over time. To truly understand what your blood pressure is doing over a full day and night, a more advanced method of measurement is required. This is where continuous monitoring becomes essential. Instead of relying on a single reading taken in a clinical setting, this approach tracks blood pressure at regular intervals over a 24-hour period. While you go about your normal routine, it includes readings during activity, rest, and most importantly, sleep. This comprehensive view reveals patterns that would otherwise remain hidden, including whether your blood pressure drops appropriately at night or stays elevated. Many people are surprised by what these results show. A reading that appears perfectly normal during the day can mask significant spikes during sleep. This type of monitoring provides a much clearer and more accurate picture of cardiovascular health, allowing for better informed decisions about treatment and lifestyle adjustments. Despite its value, it is not always routinely recommended, which means many individuals never have the opportunity to see this full picture unless they specifically ask for it. The difference between a single snapshot and a continuous record is significant. It is the difference between guessing and truly understanding how your body is functioning by capturing the natural fluctuations that occur throughout the day and night. This method helps identify risks early, often before any symptoms appear. That early awareness can make a critical difference in preventing long-term complications and improving overall outcomes. Beyond monitoring blood pressure itself, there are additional ways to detect the early effects of sustained elevation on the body. One of the most important areas to evaluate is kidney function. The kidneys play a central role in regulating blood pressure, and they are also highly sensitive to changes in it when pressure remains elevated. Over time, even subtly, it can begin to affect the tiny filtering units within the kidneys. This process often starts at a microscopic level, long before any noticeable symptoms develop. By the time standard tests show clear signs of reduced kidney function, significant damage may have already occurred. However, there are more sensitive methods that can detect early changes. These tests look for small amounts of protein that leak into the urine when the kidneys are under stress. This leakage serves as an early warning sign, indicating that the system is being affected even if everything appears normal on the surface. Identifying this signal early creates an opportunity to take action before the damage becomes more serious. It shifts the focus from reacting to problems after they develop to preventing them in the first place. This proactive approach is especially important for individuals with high blood pressure, as it allows for adjustments in treatment and lifestyle that can help protect kidney function over the long term. Another important aspect of cardiovascular health that often goes unnoticed is the condition of cholesterol within the bloodstream. Most people are familiar with the concept of good and bad cholesterol, but there is another layer that is less commonly discussed. Cholesterol can undergo changes when it is exposed to oxidative stress, a process that alters its structure and makes it more harmful to blood vessels. This modified form is more likely to contribute to the buildup of plaque within arterial walls, leading to stiffness and narrowing over time. Standard cholesterol tests do not always capture this distinction, which means a person may appear to have acceptable levels while still experiencing underlying damage. This is particularly relevant in the context of sustained high blood pressure, especially at night, when the combination of mechanical stress and oxidative processes can accelerate vascular damage. By looking beyond basic measurements and considering more detailed markers, it becomes possible to gain a deeper understanding of what is happening within the arteries. This insight can guide more targeted interventions, helping to reduce the risk of long-term complications. It reinforces the idea that cardiovascular health is not defined by a single number but by a combination of factors that interact over time. When these different pieces of information are considered together, continuous blood pressure patterns, early kidney stress indicators, and more detailed cholesterol analysis, they provide a much more complete picture of overall cardiovascular health. Each element offers a unique perspective, and together they reveal patterns that would be impossible to see through routine checkups alone. This integrated approach allows for earlier detection of potential problems and more precise adjustments to treatment strategies. It also empowers individuals to take a more active role in managing their health. Instead of relying solely on occasional measurements, they gain access to data that reflects how their body is functioning in real-world conditions. This level of insight can be transformative, turning uncertainty into clarity. It shifts the focus from reactive care to proactive management, where risks are identified and addressed before they lead to serious outcomes. While these tools are widely available, they are often underutilized, partly because they require a more intentional approach. Asking for them, understanding their purpose, and following through with recommendations can make a meaningful difference. It is not about adding complexity for the sake of it, but about gaining the information needed to make better decisions and protect long-term health. One of the most practical and impactful changes that can come from this deeper understanding involves the timing of treatment. Many people follow a routine of taking medications at a specific time of day without considering how that timing aligns with their body's needs. However, research has shown that when certain medications are taken can influence how effectively they work, particularly in relation to nighttime blood pressure. If the goal is to maintain stable pressure throughout a full 24-hour cycle, then the timing of medication should reflect when protection is most needed. For some individuals, taking medication later in the day or in the evening may provide better coverage during the night, when hidden spikes are more likely to occur. This approach does not involve changing the medication itself or increasing the dose, but rather adjusting the schedule to match the body's natural rhythms. It is a simple concept, yet it can have a significant impact when applied appropriately. Of course, any changes to medication timing should always be made in consultation with a healthcare professional, as individual needs can vary. The key point is that timing matters. By aligning treatment with the body's patterns, it becomes possible to improve effectiveness without adding complexity. This reinforces the broader message that small, informed adjustments can lead to meaningful improvements in long-term health outcomes. In addition to medical strategies, there is growing interest in natural approaches that may support healthy blood pressure, particularly when used consistently and with proper understanding. Certain plant-based options have been studied for their potential effects on the cardiovascular system, and some have shown measurable benefits. In controlled settings, these natural compounds often work through mechanisms similar to conventional treatments, such as supporting blood vessel relaxation or reducing oxidative stress. However, the effectiveness of these approaches depends heavily on how they are prepared and used. Many people consume herbal teas or supplements in forms that are too weak or inconsistent to produce meaningful results. Proper preparation, dosage, and timing all play a role in determining whether these options can provide real support. It is also important to recognize that natural does not mean risk-free. Even plant-based compounds can interact with medications or affect the body in unexpected ways. This is why any addition to a health routine should be discussed with a qualified professional. When used thoughtfully, these approaches can complement traditional treatments and contribute to a more balanced strategy for managing blood pressure. They are not replacements for medical care but can serve as supportive tools within a broader plan. The key is to approach them with the same level of attention and care as any other aspect of health management, ensuring that decisions are informed by evidence rather than assumptions. Small, everyday habits can also have a significant impact on how blood pressure behaves during the night. Evening routines, in particular, deserve closer attention because they directly influence the body's transition into rest. What you consume, how you unwind, and the quality of your sleep environment all play a role in shaping nighttime Patterns, for example, consuming alcohol close to bedtime may initially create a sense of relaxation, but its effects on the body are more complex. After a few hours, the body may respond with increased activity in the nervous system, leading to a rise in blood pressure during sleep. Similarly, certain foods or beverages consumed in the evening can interact with medications or affect hormone levels in ways that are not immediately noticeable. Sleep quality itself is another critical factor. Frequent awakenings, even brief ones that are not remembered, can trigger stress responses that cause temporary spikes in blood pressure. Over time, these repeated disturbances can contribute to sustained elevation. Creating a consistent and calming evening routine can help support the body's natural rhythms and reduce unnecessary strain. This might include limiting stimulants, maintaining a regular sleep schedule, and ensuring that the sleeping environment is comfortable and free from disruptions. While these changes may seem simple, their cumulative effect can be powerful. They represent practical steps that individuals can take to support their cardiovascular health without relying solely on medical interventions. At the core of all these considerations is a shift in awareness. Understanding that blood pressure is not a static number but a dynamic process that changes throughout the day and night is essential. This perspective encourages a more comprehensive approach to monitoring and managing health, instead of focusing only on readings taken during a doctor's visit. It highlights the importance of patterns and trends over time. It also emphasizes that the absence of symptoms does not necessarily indicate the absence of risk. The body can maintain a sense of normalcy even while underlying processes are moving in an unhealthy direction. By expanding awareness to include what happens during sleep, individuals gain a more accurate understanding of their cardiovascular status. This knowledge can lead to more meaningful conversations with healthcare providers and more informed decisions about testing and treatment. It also reinforces the idea that proactive care is more effective than reactive care. Identifying potential issues early allows for interventions that are less invasive and more likely to succeed. This shift in mindset from reacting to symptoms to anticipating and preventing problems can have a profound impact on long-term health outcomes. It empowers individuals to take an active role in their well-being and to seek out the information needed to make confident decisions. Another important aspect to consider is the role of communication in healthcare. The quality of the interaction between a patient and their healthcare provider can significantly influence outcomes. Individuals who ask questions, share concerns, and seek clarification are more likely to receive care that is tailored to their specific needs. Bringing up topics like nighttime blood pressure, continuous monitoring, or medication timing can open the door to more detailed evaluations and personalized recommendations. It is important to remember that healthcare is a collaborative process. Providers bring expertise and experience, while patients bring knowledge of their own bodies and daily habits. When these perspectives come together, the result is a more complete understanding of the situation. Preparing for appointments by noting down questions or observations can make these conversations more productive. It ensures that important topics are not overlooked and that decisions are made with as much information as possible. This level of engagement is not about being demanding. It is about being informed and involved. It reflects a commitment to taking responsibility for one's health and working in partnership with professionals to achieve the best possible outcomes. Over time, this approach can lead to more accurate diagnoses, more effective treatments, and a greater sense of confidence in the care being received. Ultimately, the goal is to bring all of these elements together into a clear and practical approach to protecting cardiovascular health. Recognizing that daytime readings are only part of the picture is the first step. Understanding the importance of nighttime patterns adds another layer of insight. Being aware of factors that influence these patterns, from medication timing to daily habits, provides opportunities for meaningful change. Accessing more comprehensive testing offers the clarity needed to make informed decisions, and maintaining open communication with healthcare providers ensures that these decisions are guided by professional expertise. When these pieces are combined, they form a strategy that is both proactive and personalized. It is not about making drastic changes all at once, but about taking thoughtful, informed steps that align with individual needs. Over time, these steps can reduce risk, improve overall health, and provide peace of mind. The body works continuously, day and night, to maintain balance. By paying attention to how it functions across the full 24-hour cycle, it becomes possible to support that process more effectively. This approach reflects a deeper level of care, one that goes beyond surface measurements and addresses the underlying patterns that truly define long-term health.